Okay, we're good to go.
Awesome. Good afternoon, everybody, and welcome to the second webinar in our series that we have. Today's focus is on covering health, safety, and sanitation for a phase 1 retail reopening. And I want to introduce our panelists here to you that we have today. I am Debbie Mollahan. I am the CEO of the Tigard Chamber of Commerce. And I'm going to introduce Alita Ostapovich. She is going to Ostakovich, I'm sorry. She is going to be doing the majority of the presenting today. She is an emergency management coordinator at Washington County, and she is currently the Emergency Operations Center liaison. Frank Brown was our presenter yesterday, and he is on board to help with additional questions. And Frank is an environmental health licensing supervisor with Washington County. We are partnering with the city of Tigard to bring this webinar series to you. So Lloyd Purdy, who is the economic development manager with the city of Tigard, is also on this panel. And Jessica Love, who you just see the name there, is actually facilitating this panel for us. And she is the community and member engagement with the Tigard Chamber. So with that, I am going to ask Alita to start sharing her screen.
Okay.
So as I said before, what we're going to cover today is a focus on helping retail get ready for a phase 1 reopening. And there has been some late breaking news. It looks like Washington County is going to try to apply for their phase 1 on Friday. And if everything goes according to plan, then maybe Washington County could open as early as June 1. That's not a firm date, but that is new news from where we've been at for the last couple of days. We are going to be providing information focused on health, sanitation, and safety with regards to retail reopening. So we're not really in a position to answer questions that are kind of outside of that boundary box. We will, if you have questions, we will take those at the end of the presentation. And the way to submit your question is if you hover over your participant panel in the Zoom webinar, you can see there's a Q&A function. So that is where you would type in your question that you want answered. And Jessica at the end of the webinar is going to help us facilitate what those questions are and then be able to answer those questions. And if we cannot answer those questions, we will take them offline. We'll provide a written answer back and we'll post that on the chamber site as well as the City of Tigard site. And if we can't get to all the questions, we'll do the same thing. So with that, and also a reminder that this webinar is being recorded. So it's being streamed right now on YouTube. It will also be recorded and then it will be available to download off of the Tigard Chamber blog as well as off of our YouTube channel. So with that, I'm going to hand it over to Alita.
All right. Thank you. So good afternoon, everyone. Thank you so much for letting me participate in your webinar. And thank you, Debbie, for the great introduction. My name is Alita Ostakovich. As she mentioned, I'm the EOC Liaison Officer. And in my day job, I'm an Emergency Management Coordinator. So today we're going to talk a little bit about reopening the county, some reopening considerations, online resources that are available, and do a Q&A session. With every presentation we do, I always do a disclaimer that this information is current as of 5/20/2020, and so even there you can see the disclaimer is not current. But this situation is evolving rapidly and information is changing, so what you hear now might not be the same as it is in the coming days or next week. So in terms of reopening the county, Debbie hit on this. We are submitting our application. The plan is to submit it on Friday. So we're currently in what is called baseline or pre-phase 1, and then we'll submit our application on Friday with the goal of opening on June 1st. So this isn't set in stone. We have one final criteria that we need to continue working on, and that's contact tracing. We've been told by the state that we don't need to have all 100 or so contact tracers to apply for reopening. So what our goal is we've signed our contract with Oregon Public Health Institute, who is conducting our hiring process, and they are working to hire 2 micro teams. So it's about 11 contact tracers in each team, hire them by Friday so that next week we can onboard and train them. So we'll be in line with that June 1st start date. So we've been using a survey from OHA to garner interest and see who is available to be contact tracers. We've also listed the positions online and have gotten over 400 applications so far.
Wow.
So OPHI is working with community-based organizations to go through that applicant list and make sure that our contact tracers mirror the community that we live in. So we want to make sure that the contact tracers are as diverse as the community that we're in now. So one of the questions we get is about the approval process for businesses. So once we get into phase one, if you're a business who from the governor's order is allowed to open in phase one, you don't need to send us an application. You don't need to send us your plans or procedures. You can just go ahead and start reopening. So the application part comes from what the county is sending into the state to get that approval to reopen. And so how the application works is that we'll put together our packet and our application and send it to OHA, who then reviews it with the public health lens and making sure that our criteria are met based on their numbers and the targets they're reaching for. And they provide their decision or what they believe the governor should do and pass it on to the governor's office. They provide a suggestion and then the governor will let us know how to proceed from there. So I wanted to dive deeper into the guidance and that we've been getting from the governor. So specifically the guidance for retail stores, which I'm sure most of you have located already. It's on the governor's website. It's available in multiple different languages. If you haven't been there yet, it's coronavirus.oregon.gov. So what I've done is taken the guidance and separated it out into what is required and what is recommended. So first we're going to look at what is required and start thinking through some questions that we should also consider based on implementing that requirement. So the first one is to limit the number of customers in your store to maintain 6 feet of distance. So this will be based on your square footage, how many displays you have, any areas where crowding could occur, and making sure you come up with a number and a system for only allowing as many people into your store as can maintain that distance. So when you're thinking about that, you should also think about areas where crowding could occur and decide whether or not those should be blocked off or if you need to post signs, if you can move out those displays or those products into different areas of your store so that you can promote social distancing, or considering that, or maybe you have displays and products that are in the middle of the walkway that can be moved or brought to the perimeter so that as people are walking, there isn't a confined space that they could brush past somebody. Another requirement is to post signs about COVID-19 symptoms and social distancing. So some things to think about with this is, do you need those posters in multiple languages? Should you laminate the posters so they're easier to clean? Are there other signs that you need? So examples of this would be a directional sign. So if you have aisles, maybe you have directional signs saying you can only go one way in this aisle. You might have signs about returns or changing rooms. You might put up signs about your customer expectations. If you expect that they will wear a mask, that they will only use credit card and not cash, things like that. So those signs can be really helpful. And you'll also have to think about where around your store you'll want to place it for people to see it and read it, where it makes sense. So another requirement is that you need to frequently clean and sanitize high traffic and commonly touched areas, as well as workstations. So thinking about your business and your layout, what are those areas in your store that get commonly touched? You know, right off the bat, we're thinking doorknobs would be one. The cash register would be another, the area in front of the cash register where people put their products or where they lean against the counter. So any other aspects that might be unique to just your business, you need to think about where a virus could live and where people might touch it and pick it up. And then also consider who will be doing the cleaning and how often. So is cleaning already a part of your employees' job descriptions and their routines? Do you need to bulk up the amount of times that they're doing these cleanings? Maybe think about doing an overhead announcement or a little bell at the top of the hour or every 4 hours whenever you determine that you want to do your frequently cleaning as a reminder to your employees that it is now time to clean. You need to provide face coverings for your employees, and your employees are required to wear them. So some things to consider with this are, where will you get your face coverings and how many will you provide? So I don't have a really great answer on how many to provide, but I can tell you that Washington County has provided all of its employees with 3 face coverings. And the thinking behind that is you have one for now, one as a backup, one that can be in the wash getting cleaned. As you're starting to think about how many face coverings you want to provide to your employees, use the same thinking that you did when you thought about how many shirts to provide, because a face covering is basically going to become part of the uniform. Somebody has their shirt, their name tag, and their face covering. You should also think about things like, do you need to have extra stock in case somebody forgets their face covering when they come to work? Or will you have a policy about what to do in these situations? Will you turn somebody away and make them go home and get it? What will you do? So then the guidance adds a lot of different recommendations or best practices for things that you can implement but aren't required. So you can use plastic or glass barriers in front of cashiers or customer service counters, encourage one-way flow of traffic. So as we were talking about, putting markers on the floor, putting signs up on the walls or the doors to help people have a visual cue to understand. Use floor markers to help maintain social distancing. So this can be great by a cash register. It can be great by your restrooms. It can be great anywhere that you think people might be congregating and need a visual understanding of how far away to stand from somebody. And also consider alternative order operations. So do pickup or curbside. So that way people aren't coming into your store as much, and you can go out and drop it off in their car. You can use a credit card for payment, so it's a lot less touching and less materials being passed between each other. Questions to ask yourself are, do you have a protocol to check employee health and hygiene practices? So one of the key foundations of this reopening is really meticulous hand washing and making sure we're using hand sanitizer and we're keeping our hands clean. So do you have a way that you're going to watch to make sure this is happening, or message it out to your employees that it needs to occur? Do you have consistent or contingency plans for higher than normal levels of absenteeism? So another cornerstone of reopening is that we'll be doing quarantine and isolation again. So that means if somebody comes in close contact with a COVID positive case, they're going to have to quarantine at home for 2 weeks. So in this case, close contact is within 6 feet of distance for 15 minutes or more. So if we are starting to experience more cases and your employees are going out into the world and living their life, they might become a close contact, in which case they won't be able to come to work. So making sure that you have plans in place for what to do as your employees might have to quarantine or you don't have as many as usual. Are you planning for staggered breaks, arrivals, and departures to reduce possible gatherings? So if you have a locker area or if everybody has to clock in on the same machine, are you staggering those breaks so you don't have a line or a lot of people touching the same machine? And are you providing education to your staff about these new procedures? So it's going to look different when you get back into the workplace. How are you telling your employees about what is expected of them and what new activities they're going to be seeing? You also need to think about communicating with your customers about new store expectations. So are you posting it on signs? Are you putting it on Facebook? Do you have a website that you can update this information on? So how are you messaging that? And then on the flip side of that, how do you have a policy or a plan for dealing with customers who won't follow those expectations? So if you say people have to wear a mask when they enter the store and somebody doesn't, how are you going to deal with that? And who in your store is responsible for that? When you're developing your staffing schedules, we already talked about that one. And then do you have a plan for cleaning and maintaining distance in your break rooms and restrooms? So these are 2 other areas in your store where it's possible that social distancing might not occur and people can start gathering. So making sure you either remove chairs and tables so there's only one area to sit, or marking off sinks or urinals to make sure people are staying distance. This might also be where your plastic or glass partitions can come into play to help keep a barrier between people. So thinking about that and where you will get those materials if you need them. So here we have a lot of online resources to help you as you start thinking through reopening and what it will mean for your organization. So the first bullet is effective disinfectants against COVID-19. It's an EPA website, and the list gets updated very frequently. It's growing and growing and growing. So one of the great things about COVID-19 is that it is pretty wimpy compared to cleaning products. So this list is very long, and even a simple bleach solution can help you fight against COVID-19. One thing to note when you're looking for cleaning products is there's not going to be anything on the label yet that says effective against COVID-19. So some of our cleaning labels say works against X, Y, and Z bacteria or virus. But because COVID-19 is so new, we haven't had time to test or develop the signs to add to the product. We also have some COVID-related posters. You can check out we have our county website, and we also have OHA's website. So something to note, if you are going to OHA's webpage, the posters are a little difficult to find. You're gonna wanna scroll down about half the way until you see the governor guidance and OHA guidance box. And then in the subset of that section, there'll be one that says OHA rules, guidance, and signs. Once you open that box, about halfway down are the posters. So it's a little confusing to get there, but they're definitely very good posters that you can use in your store. We also have Business Oregon's Small Business Navigator, and I could talk for hours about how wonderful this website is. It's got so many great resources if you need financial support, if you need workforce assistance, if you want to call somebody because you have questions about reopening and the things that you're implementing, you're looking for guidance. They've got a phone line. It can be translated into multiple different languages. There's such great information there that I really recommend you take 20 minutes to click through links and dive down that rabbit hole. Another great resource for finding out guidance about reopening and what you should do is turning to your licensing agencies. So we have a couple of listed here for OSHA, OLCC, Department of Agriculture, and then the Board of Cosmetology. You also might receive your business license through your city, so it's a pretty good idea, I think, to check out their website or go through the normal channels you would for your licenses to make sure you're thinking of all of the considerations before you reopen. I'm going to turn it over to Debbie now, I think, for the last couple of slides.
Thank you, Alita. So here's some more online resources, and some of these are more focused specifically on retail and mall guidance. And these came out from OHA. So these are the specific guidance that the Oregon Health Authority has put out. So one is focused on retail, and there's actually another subset that is focused specifically on malls. And then there's a general employer set of guidance as well. So depending on whether you're kind of standalone retail or you're in a mall, you would need to combine that with the general employer guidance. And then there's also some links to other businesses because there's some other business requirements. So there's several hyperlinks in those documents. And the reason we shared the links instead of actually sharing the PDF is those might continue to get updated. So having that link to that PDF is your best course. We also have a local Tigard business that can currently provide you bulk sanitizer if you're interested in buying it. So if you're familiar with Rose City Distilling, they previously and currently make whiskey and vodka and all sorts of different things. And they have transitioned at least a part of their product line into making sanitizer. They've been providing it for Tigard PD, but now they are now in a position where they can sell it. And so these links here will give you what their pricing sheet looks like and their order form, and then you would connect with them at this email address. So that is a local Tigard resource. So with my chamber hat on, that's why I'm sharing it. There's obviously, you go to the store and buy other types of disinfectants, but if you're looking particularly for a hand sanitizer, this is one option. Let me go to the next slide. So Alita was talking about some like downloadable signage you can get. And so these are some of those examples that you can get off of the OHA COVID-19 website underneath the guidance. As she said, you got to kind of dig down there. So there's one on just kind of giving people some visual cues about don't congregate, stay 6 feet apart. These other ones like cleaning your hands and saving lives could be something that you could be posting in your restrooms or in your break rooms or wherever your employees are also washing their hands. There's another good sign here that you could be putting maybe at your front entrance as well as in employee areas that talk about what the symptoms of the coronavirus are and recommending that people go home. And that last poster that you see actually comes from a CDC site. So the CDC is also providing some really good signage. This is just an example of one of those. And then once you get to that hyperlink, there's a whole bunch of other signage. They also have a bunch of social media sized images as well, that if you wanted to incorporate this into a social media campaign for your business, you would be able to do that. So we kind of want to just give you an idea of what those things look like. You can figure out what makes sense for your business by going to those two websites and then downloading that and either printing them or incorporating them into a social media campaign or something like that. Next slide. And then recently, the Oregon Office of Emergency Management shared a bunch of different tools that they had received from CDC and then some other like larger organizations. So in here at these hyperlinks, so these are actual PDFs that you can download because they were sent to us as PDF documents, is a decision tree for figuring out how and when to clean and disinfect. There's also a CDC guide for kind of reopening America, and it can cover the gamut of business all the way to home, but it's got some really good information in it. It's about 9 pages long. And then as we get a little bit more retail specific, the International Council of Shopping Centers shared a coronavirus reopening guide. It's about 3 or 4 pages long, so got some good content in it, but it's not going to make your head explode in terms of how much some of these things I've seen are really, really long. And then like if you're a building owner, maybe with some retail tenants, or you're some other type of retail, but you also own the building and you haven't been in the building for maybe a couple months because you've been remote. This BOMA guide kind of takes you through what you should be thinking about as you want to prepare to re-enter your building, bring people back into your building, and those types of things. And then this last document, Target, the retailer, shared a guide as well of how they're currently managing all of that. So obviously this is a huge retailer, may or may not correlate to some of those of you that are listening, but after reading through it, there's some basic practices I think you can take from some of the areas where they're either looking at front of house retail and how they're interacting with a customer and how they're trying to make that safe, how often they're sanitizing, those types of things. And then also how they're managing their back of house, like maybe where they're pulling stock or a break room, and then even distribution areas, which probably won't apply to most of you. It's a really long document. It's easily skimmable, and you can kind of go through it and look at where there might be nuggets that you could apply to your business. So all of those resources, I think, will be helpful in terms of looking at what you could be doing as you reopen your businesses in a retail environment. I think right now it's time for Q&A.
Debbie, before we move into Q&A, I have 2 requests of our panelists. We didn't do this yesterday, but Alita, can you go back and review with everybody again I think I saw 2 requirements that were, there are things
2
that...
slides of requirements. So we've got 2 on this slide. I'll let everyone review. So limit the number of customers in your store to maintain 6 feet of distance and post signs about COVID-19 symptoms and social distancing. You're also required to frequently clean and sanitize high traffic, commonly touched areas and workstations. And you are required to provide face coverings to your employees.
Okay, so there's 4 requirements that have to happen for each business, no matter what else they do.
Yes.
I think the other thing too is understanding with that 6 feet of distancing, what your total occupancy can be, because it's probably going to be way different than what your fire code normally would be. And so we utilize this for the farmers market. We're going to be opening our farmers market in a couple of weeks. And we had to figure out how many people we could allow within a confined footprint in a street. And so if you think about a 6 foot diameter, so it's the radius. So think if somebody's got their little bubble that's following them around. When you do the math on how many square feet that is, let's just round up because it's like 28.2. If you just use 30 square feet kind of as your rule of thumb, that would enable you to kind of figure out what your occupancy could be in an open space with customers, as long as everyone does their part in staying 6 feet apart.
Right. And speaking of some of those very tactical best practices, Frank, I'm going to head your way here because yesterday Frank shared some fabulous advice with those who tuned in from the restaurant sector about best practices and things to do. Are there one or two things that you mentioned yesterday that translate into retail? I can think of one, but is there anything that you want to share because it applies to business because it's business and not just because of a restaurant?
Well, I was going to mention that, I mean, Alita touched a little bit on like if you've not been operating for a while, getting back in and making sure, your hot and cold water works if in your toilets and those kinds of things. Or if you've shut services off for providers, like maybe a pest control or solid waste, recycling, those types of things, you got to get those things going again. So just don't forget those things and get in there ahead of time. Do some, get your cleaning done, as you start finding out when we're going to reopen, then you have some time. And that's the other thing I just want to throw out there is like, we do have some time to do a little more research, everybody. So looking at some of these resources that are available, a lot of them are PDF and you can skim and search and find stuff real fast in those. So just know that that's there. And I wanted to reiterate, the question yesterday was brought up about how frequently should you be disinfecting? And I didn't have the great answer. And so I kind of punted with a 4-hour thing. But as I researched this and I listened to another podcast earlier today, they are focusing on what Alita mentioned, and that is those high touch areas, a minimum of an hour to disinfect those or more. So, that's pretty intense. I'm thinking, that's a lot to think about, but that's something that those keypads, if people are punching in their PIN number or something like that. But again, trying to minimize touch points is going to be very helpful to folks in the, in the long run in this process. So, touchless payment, touchless, ordering, touchless entryways to the bathrooms. We, think practically about those bathrooms and having a trash can inside and outside. So you have a touchless handling of the door that people are going in and out of the bathrooms. And then, I know it's not easy to do, but if there's a way to do touchless hand sanitizer, that would be useful as well. Get that hand sanitizer out for folks so that at least we're knocking down that potential germ load that might be on someone's hand. So I'm talking more than I probably, that was supposed to be a shorter answer, and I gave a really long one.
Well, I think actually going over hand washing would be good because like in the restaurant industry, that's kind of an understood thing, and then how not to contaminate. But I think for the rest of us that might just be running a normal business or we're in retail, we don't really think about that. And so like yesterday's dialogue was like, have your paper towels ready, wash your hands, wipe your hands on the paper towel, use the paper towel to turn off the sink, which I've always wondered, like, how do you turn off the sink without recontaminating yourself? And then use the paper towel to open the door, which is why you need that trash can on the outside of the door as well. So I hadn't really thought through that whole process. So I think that was really good advice from yesterday as well.
Good, thank you.
And I think in addition to how you properly hand wash, I'm thinking through all the times you're going to now have to hand wash or use hand sanitizer. Some of the guidance says before you process a return, after you process a return, when you touch a credit card, when you accept cash for a transaction. If you're going into your break room, wash your hands before you have lunch, wash your hands after you have lunch. If you're touching a microwave or a fridge, wash your hands before touching your food because that's going in your mouth. So there's so many times when you'll need to actually do this and use hand sanitizer that kind of wrapping your head around that is mind-boggling.
And figuring out how to communicate that to your employees in a succinct manner and provide cueing so they can remember as well.
right?
Those are all
In
great
general,
points. Go ahead.
I was gonna say in general, you usually want to wash your hands for 20 seconds. So, turn the water on, get it warm, get that little moisture on the hands, get the soap, lather, 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 lather. People usually sing the happy birthday song a couple of times through. That's going to give you 20 seconds, and then you're done, you dry it, and you go out. So go ahead.
I actually did find a really good video on the CDC site. I think it's located at that same site that I have the hyperlink for. It's about 2 minutes long, and there's a nurse in there washing her hands and talking you through the whole process of how to wash your hands, use the paper towel, but she's visually doing it. So if that's helpful for people, they can find that there as well.
Good.
It's been great guidance, great advice. Jessica, are you prepared to guide us through some of the questions that have come up in the chat? And Debbie, can you remind everybody what to do if they have a question?
So if you have a question, reminder down at the bottom of your screen, you might not see the menu if you hover your mouse, so you should see a menu pop up, and you should see a Q&A box, and you should just be able to type your question in there, and then we can see that.
Yeah. Okay, so for the first question, are there guidelines on staff bringing their own face coverings, or is it mandated that businesses supply the PPE?
I think that is a really good question. And I mean, all the guidance documents, it says that a business must provide the face covering. But I think if you're having a conversation with your employees and there's an expectation that if they can provide one, you can provide the other two, but just making sure that you don't leave anybody hanging and without the protection that they need.
And one of the things we will add to the slide deck before we turn it into a PDF is we also have a great hyperlink to a ongoing updated list of PPE providers in the Portland area. There's like 100 businesses on there so far.
Mm-hmm.
And I'm remembering, Alita, you mentioned that it might be very responsible to make sure every employee has 3 PPEs.
Yeah, or 2, more than just the one, because if you have one, you'll have to wash it every single night when you get home. And you're already tired, that's already a strain. So having 2, at least you can cycle through.
Okay, great. What's up next, Jessica, question-wise?
If Washington County is approved for phase 1, can my office workers return, or is it just the sales staff?
To my understanding, the return to the workplace is phase 2, not phase 1. And so we're even stressing, even once we get into phase 2, moving back into the office, we still want to do telework. So as much as possible, keep people from interacting with others in close contact. I mean, so you can still be social, have phone calls and Zoom, but the physical space we want to expand.
Thank you. And then we've had a few people asking questions about clarification of what signifies a retail business. So we've had people asking about salons, massages, facials. We've had a dance studio ask what they fall under. So what would be the definition of a retail business?
So for retail business, we have to do definition by exemption, I think. So in terms of salons, hairstylists, massage, that all falls under personal services. So I'll read the list for that. So a personal service is a barbershop, salon, esthetician's practice, medical spa, facial spa, day spa, non-medical massage therapy, nail salon, tanning salon, and tattoo or piercing. In terms of a dance studio, that would fall under a fitness organization, and they have their own separate guidelines. So retail is kind of anything left not specifically called out there.
Thank you. Next is if a business is taking temperatures, this is a salon owner posted this, but we're going to generalize it. So if a business is taking temperature of their customers as they can come in, do they need to keep a record of their temperatures?
So for this one, I know you're trying to generalize it, but I am going to ungeneralize it. In the guidance for salons, they do have to keep records, but in the guidance for retail, they do not.
That was the next question is what kind of information, if they do have to keep information, do they have to keep on file about their customers? So their name, their email, do they have to have a sign-in sheet when they come into their retail store?
Yeah, so the guidance doesn't suggest that retail stores need to keep anything for their customers who are coming in, but for personal services and fitness services, there is detailed guidelines on what information you need to keep.
And
In terms of if the county contacts you about somebody who is COVID positive and wants information, the information they'll be looking for are the employees that they interacted with in close, the areas of the store that they might have gone into, and then contact information for any of those employees that they interact with.
And then how does a business protect themselves if an employee has issues with wearing a mask?
Yeah, I think that is a really good question, and I'm trying to pull through my guidance to see where I have seen this, but with somebody who has a health issue or is part of that high-risk vulnerable population, I mean, we're really trying to keep them out of contact with other individuals. So it's really not suggested to have them out a lot. So maybe you can come up with alternative work assignments that keep them more separated. You can put them onto non-peak hour shifts, hopefully so that they interact less with customers. And then having a conversation, I think, with the employee just to brainstorm together and come up with a plan together on how to keep them safe.
And then this is about nonprofits, but I'm going to generalize it a little bit as well. So they're specifically asking about volunteers that are over the age of 60, but if you have staff that are over the age of 60 or are part of the, what's the word that I'm looking for? Totally said that.
Higher risk groups.
Thank you. The higher risk groups. Is there any specific guidance for those scenarios on coming into work or not?
I haven't seen anything specific. I can make a note of that and go back through and try to see what I can come up with. I'll send it to Debbie if I find anything, and I think she can pass it out to the group.
So I think I want to go back to the question that was asked about wearing a mask. When I'm looking at the question, I think the way I'm reading this is I know I've read some guidance where if like a person maybe has some respiratory issues or something like that, and wearing a mask is going to create a problem for them. I think that's how the question is being asked. Like, how do I protect myself if I have an employee that's in that category where for a health reason, they can't wear a mask? So my question to you, Alita, would be, would a face shield be an acceptable alternative because it's not enclosing, but it's still protecting?
Interesting. And that, again, I don't think I have an answer off the top of my head, but I will research it and get back to you because I think that could be a really great option if supported by public health.
And there are some populations like children under the age of 2 that have, no facial covering is required, so take a look at some of that information from the Oregon Health Authority about facial coverings, because it does help explain like breathing conditions and that there are some folks that it's not as advised as it would be with others.
Yeah, thank you. And actually, I did the research and now I have an answer.
Woo-hoo!
So in the guidance called Mask and Face Covering Guidance for Business, Transit, and the Public, it says businesses must require employees, contractors, and volunteers to wear a mask, face shield, or face covering unless an accommodation for people with disabilities or other exemptions applies. So based on that, I think a face shield would work. And it also leaves language that if that is still not working or is still endangering your employee, then they can be exempt.
I also noticed in that particular guidance, they also specifically define what they mean by business. So it's not that broader definition of all business. There's specific segments of business that are required in that whole masking thing.
Right.
we have a lot of people. It seems like we have a few people on here that are part of the personal services call. Can you give a brief advertisement for tomorrow's phone call
Sure.
to direct them to that?
So tomorrow we're going to be running same time, same bat channel. For those of you that are old enough to remember that lingo, 3 o'clock tomorrow, we'll be having a webinar just like this, but with a specific focus on personal services. So going through that OHA guidance and hopefully providing more details with regard to that and being able to answer those questions that are specific to your guys' sector. You would use that same link that you came on. So all of our webinars have the exact same link. They'll also all be recorded, and we'll also transcribe all of the PowerPoints into PDFs.
And tomorrow we will be better prepared to answer those questions about
Hopefully, yes.
services.
Looks like there's a
Then-
couple more questions that we had, Jessica.
Yeah. So another question is on refreshment. So if a retail store, I know I walked into a few stores where they'll have like a coffee station, or, you know, they'll have a beverage for you to enjoy while you're shopping for clothing. Are there any guidelines or restrictions on having refreshments, maybe, or in food, refreshments and food available for people as they're shopping through your store?
So since I'm the food person, I'm going to just mention, and Alita, you can tell me I'm wrong here, but generally that kind of thing, we're trying to discourage people from communal food activities per se, or self-service type of food activities. And that sounds a lot like what that question was about. There might be an opportunity to provide like a sealed beverage of sort that would have minimal contact by a lot of different people. So like I'm looking at and I don't have them on my desk, but a bottled water or something like that, that's, you know, someone could individually pick that up and not be touching all the other components. And as we're talking about that, you know, look at your water fountain. You know, that's a communal situation. So don't forget about that water fountain on site. And as much as, you know, we want to make sure people are hydrated and stuff, I think one of the other goals is to try to get people in and out of your facility. You know, I know you want them to shop and enjoy, and that's part of the process. And I know I've spent hours in a department store in my life. But anyhow, I digress. You know, ideally get folks, you know, in and out too, so that they have less, you know, you can get more folks through and there's less exposure if there's something going on too. But watch that water fountain and the communal food service, not.
But you could like give somebody a packaged cookie, something like that.
Yep.
Very cool. That's all the questions that we have from the group currently.
Are there any final, oh, here's a new one.
Okay, so this one is, can we give a time limit on browsing?
Good question. But I you know, I think what signage you put up, and you know, I think there's some suggestions about things like that. You know, I know some of the grocery stores that I've been in have signs like you really only want one person in the party, if at all possible, two, so that they can get more people in and more people have access. So, but I think it's going to be, you know, more a decision of yours if that's something that you're going to look at trying to do. But I don't know if, you know, we can't say, well, you got to, you know, cut it off at any point. That's not a direction that we would be able to provide.
I do know, though, taking from kind of our food partner industries that have already been open, that, you know, having signage that says, you know, like, don't touch stuff that you're not planning to buy, and those types of things is a lot of the things that could have a really good crossover into retail.
Yep. And I was going to just mention too, I know that we're kind of wrapping things up here, but you know, Alita talked about employees and making sure your employees are trained like immediately, you know, when they're coming back is so very important. So if there's a way to message your employees as soon as you can, you know, like tomorrow, you know, soon, to let them know, hey, here's some of the expectations, please read these over, or watch this little video that's available on hand washing, or just that kind of thing to get people kind of thinking about what it's going to be like to come back, what the expectations are.
I also think going back to the question that was posed on, can we give a time limit on browsing? So getting people in and out of your store. You're the business owner. So, I mean, I'm assuming a lot of these are business owners or managers on here, and it's your store. So you could set what rules you think are going to benefit your business. You probably just need to give some thought as to what language you want to use so it comes across as positive as possible. Like, I love that you're here. I'd love to help make you efficient in your shopping. You know, maybe there's some things your staff can be doing to facilitate a quicker, you know, browsing experience, or maybe how you're retailing your shelves or whatever can make that browsing a little bit easier.
And I would say, just to pipe in real quickly, from like what I've seen from farmers market perspective is when the customer enters in and they have they're used to an experience in your business. So maybe you give them a beverage, or you give them a refreshment, or, whatever your experience is that you give your customers when they enter the store, maybe alter it somehow so that it doesn't encourage lingering, and it's more of a come in and shop and try to move quickly throughout the store while still giving a positive experience. So trying to get that back to an even, be safe, but still enjoy type of.
Well, I also think too, if we can help customers understand that businesses are operating under these occupancy constraints that are different than the prior environment, and by you spending 2 hours in my store, that prevents somebody else from coming in. So out of courtesy to your neighbors and your fellow consumers that also want to be shopping, so putting it more in that language of thinking about maybe the others that also want to be shopping and need to do their, purchases, so limiting your time. So I think there's ways to have that language.
Yeah, good point.
And then we had one more question that came through. How do you recommend how to manage customers touching product, and what do you do with that product if it's been touched? Any guidance on that?
Well, I know that there's some signage that I've seen in some other retail stores where they ask you to touch with your eyes as much as possible. I don't know if that's the right way that was pointed, but to try to really look at the product without touching it. So if we can do something to help encourage our customers, to do that, that would be a really helpful thing. And signs, I think signs are going to be really, important friends to us as we're trying to move along in this process. And there is some guidance about like product returns and that kind of thing too, that's in the state document, and that might be a good way to go with that. I have to say the reality is I'm not going to see everybody touching product. So I would just suggest you're going to do your best with stuff, and then look at that returns guidance. Alita, I don't know if you have I think I had it open there for a minute, but
yeah, in terms of return guidance, one of the things that it says is that retailers may set aside items for a day or longer if they're concerned about a perceived risk of exposure. So that's the guidance, but also take that in stride. Don't eagle eye around your store at everything somebody could touch and go move it to the back room for a day and shuffle around your shelves. So it's an item that nobody has touched before. I think if you're working on the broader physical distancing aspects and you're cleaning your hands, you're not touching your face, and you're doing your face masks, then I think the risk will be relatively low, and that's not really the area that we should focus our concern and our efforts on.
I have seen some retailers have closed like their dressing rooms, and right now they're not allowing clothing try-ons. So smaller retailers that are looking at reopening that have a clothing element might want to consider that.
And then, are you aware of any infrared or UVA lights that are effective with COVID?
yes.
Oh,
Can I just say yes, and then we don't go any further than that? Yes, there are. There's actually some technology, UV devices. I can't mention brands. I don't really feel like that's appropriate, but UV light is effective. Some of them are designed where, they will basically disinfect an area. You have to be careful about things. I actually sat through a seminar actually on this the other day.
Oh,
So
cool.
yay, because UV is really cool, and UV's been used for a long, long time for, mostly tuberculosis control. So, but it does have a great effect on a virus that's fairly fragile, as Alita had pointed out earlier. But I want to say that, the cost of that type of thing might be, if you research it a little bit, might be a little bit high. And I would go with a UV light system, if you're going to go with that, that's designed to disinfect an environment. Not the little hand wand necessarily that you might see or something. You want to make sure that it's actually shown some validation to give the disinfection that you want. Okay, so just be aware of that. You're gonna, I don't know about you guys, but I get pop-ups on my email and my account all the time now for new facial coverings and all that kind of stuff. So just know that there's stuff out there, but you really want to make sure that it's going to provide the level of disinfection or protection that you're looking for, and it needs to have some science behind it. So be aware of that.
Frank, did our guest ask that question just so you could hit a home run?
Thank you for doing that. No, I'm just kidding.
Planted somebody in the audience. Ask this question.
These have been great questions, all of them. Looks like we just worked through them. You all have been great again with some very specialized content, some very relevant content. Debbie, thank you for moderating. Alita, Frank, thank you for sharing your wisdom with us. Jessica, thank you for running the show. Again, all I want to say right at this point is thanks. Thanks for bringing this content to the community.
And thank you so much for having us. We really enjoy it, and we love presenting and fielding questions and making sure everybody is confident moving forward.
So a reminder to our audience, we are recording this, so it will be available for you to either go back to and watch or share with someone who was unable to attend. And the slide deck will also be turned into a PDF, so it's easier to utilize than a PowerPoint. And the hyperlink should live within that document as well. The city of Tigard is also working on trying to get these recordings as well as the PowerPoint presentations translated into Spanish. We don't quite have a timeline on that, probably sometime next week at the earliest. And so when that content's available in Spanish, that will also be posted.
Debbie, can you remind everybody where they can go for the links page that you are setting up? Because not everybody on the call is necessarily from Tigard. We opened this up to all of Washington County.
Yes.
Just a quick reminder.
So we're in the process. The page isn't live yet, but we're in the, you can go to our blog to get to, so go to tigardchamber.org and just click on our blog link, and that will get you to the videos as well as the PDF files. We are also working on developing a web page with business resources that will have links for general resources. So something that can apply to all businesses. So like these signage things you've seen, or how to, the decision tree for disinfection or disinfection or sanitizing, those types of things. And then there'll be specific sections of that page that will also have specific sector related guidance as well. We're working on bringing that page up. So once that page is live, there'll be a really easy link off the Chamber's main page to get to those expanded resources as well.
Great. Again, thank you. Thank you to all of our guests who joined us.
Thank you.
For you all on everyone on the panel. Great work. Thank you again. I'll see all of you tomorrow, and anybody that wants to tune in again, you're welcome to do it. The content will be focused more on personal services. Take care and be well.
All right.
Bye. Thank you.
Bye.